As students head back to school, some parents may be wondering whether the Trump administration's proposed vaccine changes affect the shots their children need. California health officials say the state's vaccine recommendations and school requirements are not changing. The Trump executive order recommends spacing out vaccines and eventually splitting the combined MMR shot into separate measles, mumps, and rubella vaccines once those are available. And with measles outbreaks across the country, joining me now is Dr. Michael Ginsberg with NorthBay Health on what parents need to know. Doctor, good morning to you. Before we dig into obviously there's the political conversation of this, what parents need to know, I just want to get big picture here on vaccines. Immunization, one of the great achievements for modern medicine. Which diseases did they help eliminate?
So good morning. Thank you so much for having me. So immunizations are one of the greatest accomplishments of modern medicine. You know, they always say an ounce of prevention is worth a pound of cure. And so some of the diseases that, for example, I'm going to turn 50 next year, I hate to admit it, and I have never seen a case of measles. I saw one case of mumps when I was like 13. There was a little outbreak. My computer science teacher got it in when I was in seventh grade. I've never seen a case of rubella. I've never seen tetanus. I've never seen diphtheria. I have never seen epiglottitis, which is a very serious infection of the throat that used to swell children's throats closed so that they couldn't breathe anymore. So I've never seen any of these diseases, polio, and we have almost eliminated these diseases in the United States because of immunization.
So incredibly important, not just protecting kids, but everyone, you're saying. Let's talk about what President Trump wants to do with spreading out the vaccinations for kids, changing the vaccine schedule. This is just a proposal. We had California stepping in and saying, no, we're going to stick with what we're already doing. What does the science say in this debate?
So there is no new information that has changed our understanding of the safety of immunizations, the efficacy of immunizations. And the American Academy of Pediatrics has come out and said that the science is very clear that the schedule that we were using was the best schedule for the United States.
How was the childhood vaccine schedule even started in the begin with?
So the childhood vaccine schedule has been built over many, many years. So some of the first immunizations used, obviously smallpox in the late 1800s, or in the late 1700s, we don't use that one anymore. But for example, tetanus immunization was introduced in the 1920s, I believe, if I have that right. And things like polio in the 1950s. So on and so forth. So we've added more and more diseases in because these diseases were very serious. And parents really did fear these diseases, you know, back when they were things that most children got because they disabled children, they killed children. And, you know, I mean, you go through some of these old cemeteries, you'll see that there are families that lost 5, 6, 7 children. So it was developed slowly over time as we were able to develop more and better and safer vaccines to eliminate these diseases.
For parents who are watching and they really don't want to be caught in the political discussion here, they're just worried about their kids' safety. Who should they believe? Who should they trust? Should they trust the CDC, public health experts, yourself? I mean, who do they turn to?
I think that you should turn to us, your pediatrician. All of us are experts in this. So when we do our training, we have extensive experience and education on vaccines, on the immunization schedule, why the immunization schedule is the way it is. By the time we finish our residency in pediatrics, all of us have given probably 10,000 doses of immunizations. So we know, here are the side effects that are common, here are the side effects that are very uncommon, here's what to expect after immunization, and we can all sort of just glance at somebody's immunization schedule and tell them, okay, this is what you're due for.
And for the folks worried about any link, there's been some theories about a link to autism. No evidence for that? No
evidence at all. And, you know, in fact, there have been a number of very large studies done not just in the United States, but across multiple countries involving many millions of children. And what those data actually wound up showing was that children who are fully immunized have a slightly lower rate of autism and developmental delay than children who are not fully immunized. That kind of makes sense because every time you get sick, there's a risk that your brain's going to take a hit from all that inflammation, from the illness, perhaps from lack of oxygen if that illness, affects your respiratory system. So it actually makes sense that you would see that in the data.
That is fascinating. Real quick here, 20 seconds, just stress the importance of staying up to date on vaccines for parents.
So it's really, really important for a number of reasons. Number one, people who spread out the immunization, their kids might need more shots. Every time you have to go to the doctor, if your kid gets 1 shot or 3 shots, it's a traumatic experience. So when you spread it out, now your kid's got 3 traumatic experiences instead of 1. And also, it means that your kid's going to be as safe as possible. That means that when you found out that you were in that shopping mall where there was a case of measles, you don't have to worry about it because your kid's already vaccinated against measles. When you found out that some produce company had to recall their, product because it was contaminated with hepatitis A,
you get that peace of mind.
You don't have to worry about
yes,
it.
Yeah, exactly. It's such an important discussion. I'm so glad you came on to talk about this. Dr. Michael Ginsberg, thank you so much for your time this morning.
Thank you so much for having me.
You bet. We'll be right back.